And if there's a theme today, it's that the county has had to pick up a lot of these different pieces that the state used to handle, but I think we're able to do them in a more effective way because we will leverage every resource locally that we can. We'll leverage local investment in that.
At this month's local Public Safety Coordinating Council meeting, Jackson County Community Justice Director Eric Geyer gave an overview of the corrective programs funded by the Justice Reinvestment Initiative and then presented its proposed budget for approval from meeting attendees.
Now the second piece that we're going to need to look at and evaluate is the Justice Reinvestment Initiative grant program. So 2013, House Bill 3194 created the Justice Reinvestment Grant Program. And it was targeted to financially support Oregon counties to plan, implement, or expand initiatives that reduce recidivism, reduce prison population, increase public safety, and hold offenders accountable. Provide community supports and responses to avoid sending people who commit nonviolent drugs and property offenses to prison. 10% of this funding goes to fund dedicated victim services. So we'll talk about what that is. So this was really the state's opportunity to say, hey, if you guys don't send these people to prison that you historically did for drug and property crimes, here is some money to provide local supports and accountability to hopefully manage that population safely and effectively within your community. But the 10% in Jackson County that we've been able to dedicate to victim services has gone to two different partners. The Children's Advocacy Center, which funds a therapy administrative assistant and a lead bilingual family support forensic interviewer. That is one piece. And then Community Works funds their lethality assessment program, which allows an officer responding to a crime of domestic violence to contact the program and have an advocate to utilize evidence-based assessment interview, an assessment interview to determine the risk of further harm to the victim. The Transitional Care Program is largely funded by this. We've had 189 people enter this program. 93 have completed. The level of involvement, engagement that those 93 have had in our recovery community has been incredible to watch. The Pathfinder Network, we've had Pathfinders present in terms of what their program looks like, taking people with lived experience who've been through this system, giving them the clinical support and that they need to do this work well, and provide a curriculum that is evidence-based has been an eye-opener for us. It's been an incredible partnership to have them on board, and they gear their program specifically for really the community justice population. People who've been in the system for quite a while, people for whom other services haven't been as effective, and people who really need that unique blend of support and skill building, and they do it really, really well. Between the Work Center and Parole and Probation, we anticipate 14 FTE peer support specialists over the next biennium. And then the Resource Center, I did mention this, multidisciplinary team providing wraparound services, healthcare, employment, treatment, housing, mental health specialists. All of these folks are involved there. The peers are right there engaged with it. And they've had 5,052 client contacts from January of 19 to July of 21. So they are seeing a lot of people. And during COVID, we didn't quite see the volume of people, but we saw the intensity rise. People who were displaced by the fire, we saw the intensity rise. The need that these folks had to find housing as it became more scarce, to find health care as they were having a difficult time getting interpersonal interactions. We were able to safely do it within the Resource Center, and we anticipate that number probably even going up as some of the restrictions may continue to be lifted. We also provide release assistance and pretrial monitoring as one of our JRI strategies, the opportunity to ensure that people within our community are given the opportunity to provide their defense, but also provide for the fact that keeping people local means a greater taxing of our local jail. So having this alternative support and for people in our community has been really important. The challenge is that so many of our people in our jail get forced released that it's difficult to engage that person and create a pretrial plan for them. So that's one of the many things that gets impacted by lack of jail space. But we do have an evidence-based tool and decision matrix, and we do monitor and respond to noncompliance for court-related release conditions.
And just one thing that's important, I think, for people to know is pretrial used to be ran at the court level. Our court system used to run pretrial there. As funding dwindled, they essentially were forced to cut the pretrial program, and we went for several years without having one. It was consequential. So this really kind of was a shift by the state in who's responsible for funding what. And it's not a program we have to do, but it's been extraordinarily beneficial, and we saw the consequences of not having the program in place, which were pretty detrimental, I think, to the whole system, including a lot more failed to appears than we have with the program in place.
Right, and we'll continue to work at that with our partners at the courts, at the jails, with the prosecution, with the defense, all of us trying to find a better solution for this in our county. And it did shift. It's one more thing that's shifted to the county level. And if there's a theme today, it's that the county has had to pick up a lot of these different pieces that the state used to handle, but I think we're able to do them in a more effective way because we will leverage every resource locally that we can. We'll leverage local investment in that. The 416 Downward Departure Program, evidence-based assessments. So the idea that we have a prosecutor and a probation officer working together to identify which program might work for a person who receives a downward dispositional sentence. So instead of prison for a drug or property-related crime, is there a community resource that works for that person? Does the Family Sentencing Alternative Program work for that person as they try and keep their family together, keep their children, and just need some different supports? Does drug court work for that person? Is this somebody who needs a treatment court experience? Does probation have the necessary tools and things to provide for that person in what they need? Since 2018, we've had 220 people plead into this. We've had 41 people successfully complete that, and we've had 50 people revoked. There's 129 people currently participating in a program or a supervision cycle that is under a 416 umbrella. I think that sometimes we hear from our community partners that 416 is too lenient, and I don't celebrate the number of 50, but there is accountability attached to it. And if folks can't comply and can't engage in our programming, steps are taken so that they will have to serve that sentence. So of the people who are successful, though, I believe that represents 1,045 months of saved prison. And at $137 per day for those prison beds, it's about a $4.2 million savings to the state in terms of what we've been able to provide for that. So again, the state invests some money in the counties. The county saves the state, 3 to 1, 4 to 1, 5 to 1 on those dollars in terms of what they get from their investment.
And the state claims it's $137 a day, but it's way more expensive than that.
There's no doubt. There's no doubt. So, and I also skipped into one extra thing. So the Justice Reinvestment Initiative were those programs that stopped with the pretrial right there. That was the basic of the Justice Reinvestment Grant Program. The next piece is the Justice Reinvestment Supplemental Grant Program. So again, not to confuse folks, but this is a supplemental piece is what the 416 program falls under. Within our entire department, we have a number of key initiatives that over the next biennium are going to be very important to what we do. One of them is equity. The idea that we are trying to create equitable outcomes for all the people we serve and not see disparities based on race or ethnicity in what we do. We have 7 different things listed here in terms of what we're trying to approach as a department. Number 1, we have a policy calling for equity, noting that we need to focus on the outcomes of the work we do and the impact it has had historically. 2, we provide training on this. So we're learning about implicit bias, we're learning about institutional racism, and we're identifying ways that we can work to be anti-racist. 3, we are employing the voices of lived experience, people who are experiencing this system to give us feedback, input, what's working, what would you like to see, how are we accountable to this group in terms of what our commitment to the community is. We're using data to drive the decisions we make and to reflect on where disparities exist. We then go back with that data and identify any place that we feel we can't justify as being completely without disparity. We have person-centered approaches to supervision as opposed to just compliance-based, knowing that different people within different situations may have different access to resources, wanting to make sure that our approach doesn't lead to greater disparity. We're looking to contract with those community partners that can provide responsive supports and responsive services. And then internal leadership around equity for those people who want to champion this work and continue to do this work further, making sure that there are opportunities to do so as they continue to drive our program forward. We're also focusing on resiliency. And I mentioned earlier that resiliency was that ability to create strength in the face of adversity, even after having undergone potentially traumatic or really emotionally intensive events. And that for us, that applies both to the people we serve as well as the officers who provide this work. And this March, we're going to have a community conference with Kim Colgrove. As I pull up her book, Kim Colgrove is working with our department. Her book, Mindfulness for Warriors, Empowering First Responders to Reduce Stress and Build Resilience. Incredibly great read. It does talk about the use of meditation and other skills to help mitigate this. If you would like a copy, you can borrow mine. I probably won't ask for it back, even though I've read it a couple times, and we have a ton within our department. Very important work as we look at the human cost of doing this in terms of what we can do. And then when we coach and work with the staff we have, focusing on resiliency and wellness, knowing that we need that for folks to do ethical work in what we're tasked to do. And CR2, which I will get into, is a primary communication and interaction model. So creating regulation and resiliency. It integrates research on trauma, resilience, and evidence-based practices. It includes a focus on staff well-being, and it introduces a two-phase communication model that can be adapted for use by all correction staff and supervisors. It can be used within a time frame, whether staff have 1 minute, 10 minutes, or an hour. It is an extension of the work that we've done historically through motivational interviewing, but it really incorporates a lot of different pieces, both in terms of brain science and what we know about how people react, as well as the wellness of the interactor, the person who's doing the work. So working with CR2 over the next 2 years to provide an entire department that can provide this intervention. So in terms of what we need to vote on today, the second one is our Justice Reinvestment Initiative proposed budget in terms of what we have listed here. Over the biennium, $284,000 is for administration of the grant, $403,000 is for the Resource Center, $437,000 for pretrial services, $585,000 for the Transitional Care Program, TCP. The Pathfinder Network will receive $1.078 million from JRI services, and then victim services at $310,000 in line with the allocated amount. So, any discussion or questions about the proposed GRI budget?
I just want to point out, so the Pathfinder, which is basically a peer mentor program, if you notice, Eric mentioned 14 FTE, and there's 31 full-time parole and probation officers that manage all of the cases, 1,800 plus cases that are on supervision. Some of those cases are in the low and limited level and are less likely to be referred for peer mentoring through Pathfinders. So we have probably, better than a 1 to 2 ratio of mentors to parole officers, and not all those cases will be referred for mentoring. So I think it's a really, it's a high ratio, I guess is what I'm pointing out here for people that don't know that, to have this specific program available to clients from peer mentors is probably one of the better moves I've seen our community justice program make in a long time.
Thanks, Danny. We're really excited about it, and it is a big investment in terms of the amount of work, and it just has been very responsive to the officer needs and the individual needs in terms of what we're doing.
Dr. Carter, I move to approve the Justice Reinvestment proposed budget.
We will do another roll call vote for this, so Amber, if you wouldn't mind.
Lieutenant Joshua Aldridge.
Yes.
Dr. Lee Ayers.
Dr. Ayers.
Yes.
Dr. Dave Carter.
Yes.
Travis Christian.
Yes.
Chief Scott Clausen.
Yes.
Commissioner Dave Dodder.
Yes.
Doug Engel.
Yes.
Eric Geyer.
Yes.
Beth Peckert.
Yes.
Barbara Johnson.
Yes.
Danny Jordan.
Yes.
Jennifer Lynn.
Take an abstain on that.
No, I'm trying to say yes. I just
All right. Thanks, Jennifer.
Judge Lorenzo Meja.
Yes.
Ilda Montenegro Fix.
Yes.
Tina Qualls.
Yes.
And Rita Sullivan.
Yes.
Thanks, Rita.
And our final grant activity of the day is for the Supplemental, JRI Supplemental Grant, which is the program that provides for the District Attorney's Office to the tune of $276,000, a probation officer at $189,000, and that's not all of a District Attorney's Deputy DA, nor is it all of a probation officer over the 2 years. Administration to the tune of $36,000, and victim services again with a 10% of $56,000. So. Questions? Would entertain a motion should somebody feel so inclined.
I'll motion to accept.
Thank you. Lee Ayers has a motion on the floor to accept the grant, or to move the grant forward. And Tina Qualls with the second. I think Tina just beat you. Sorry. Thank you, Tina. And our last roll call vote of the day.
Lieutenant Joshua Aldridge.
Yes.
Dr. Lee Ayers.
Yes.
Dr. Dave Carter.
Yes.
Travis Christian.
Yes.
Chief Scott Clausen.
Yes.
Commissioner Dave Dodder.
Yes.
Doug Engel.
Yes.
Eric Geyer.
Yes.
Beth Peckert.
Yes.
Barbara Johnson.
Yes.
Danny Jordan.
Yes.
Jennifer Lynn.
Yes.
Judge Lorenzo Meja.
Yes.
Hilda Monterrego Fix.
Yes.
Tina Qualls,
Yes.
and Rita Sullivan.
Yes.
All right.